be extended? Well, the government right now is saying no, it's not going to be extended. So then what happens? Now, multiple theories, but one of the possibilities that is coming to the fore is that the government is going to end the lockdown across the entire country, because after all, there are many parts of the country where we're not actually seeing coronavirus. And instead, the government will focus on certain specific hotspots and have a strategy around that. Now, what does that mean? Any place where you've got more than a few cases is called a cluster, and then a place where there are more than a couple of clusters starts to get identified as a hotspot. Now, in this sort of a strategy, what would tend to happen is that while you may have a lifting of the lockdown across large parts of the country, hotspots will continue to face severe restrictions. There could be everyone inside the hotspot could be quarantined in some form or the other. You could be having people from here being prevented from moving to any other part of the country. You could have people from here being sent to specific hospitals in case any symptoms start to arrive. You could have a lockdown of a more extensive type. Different strategies can be worked out by the government for these specific hotspots. Now, if you take a look at what the possible logic for this is, even if you look at the number of cases in India right now, 1,600 cases or however many that we have, it's already clear that many of these cases are actually linked to one or more hotspots. Nizamuddin being the most obvious one. Then you had a particular hotspot in Rajasthan. You had in Mumbai, there have been a certain number of cases. Identify the hotspots, put down some sort of a lockdown around those, and then you may not have the need for a more generalized lockdown. But it's a theory. Let's see if this is the way things are going to actually play out or not. But here are the big headlines today.
In its biggest spike till date, India over the last 24 hours recorded 386 new cases of coronavirus, with the total now standing at 1,637 cases. The death toll currently stands at 38, said the Ministry of Health and Family Welfare in its daily briefing. Joint Secretary in the Health Ministry also added that one of the main reasons for the spike is the travel by members of the Tablighi Jamaat.
As the Delhi police was evacuating hundreds of people from Tablighi groups in Nizamuddin Markaz, National Security Advisor Ajit Doval visited the southwest Delhi area and took stock of the situation. According to multiple reports, Doval arrived around 2 a.m. on March 28th and 29th night at the Markaz and interacted with police officials involved in evacuation. He also convinced Tablighi group leader Maulana Saad to get all stuck persons tested for coronavirus and quarantined, reports said. NSA chief knew about the situation building up since the security agencies had tracked down 9 corona-positive Indonesians in Telangana's Karimnagar with travel history to the Markaz on March 18th.
As the number of COVID-19 cases surge in India, the government has reportedly identified 10 hotspots where higher viral transmission has been detected. The hotspots that have emerged across the country are Dilshad Garden in Nizamuddin in Delhi, Noida and Meerut in Uttar Pradesh, Bhilwara in Rajasthan, Ahmedabad, Kasargod, and Pathanamthitta in Kerala, Mumbai and Pune. The identification of these places will help ramp up the testing process, an IANS report has said. According to the virologists, an area where there are 10 virus infection cases at a given time is called a disease cluster, and if several such viral disease clusters spring up in the vicinity, the entire region is identified as a hotspot. But the Union Health Ministry has maintained that the process to identify the COVID-19 hotspots in India is not uniform. The concept of a hotspot changes according to the data and inputs on the virus, senior health ministry officials have said. Once the health agencies identify a disease hotspot, the area is put under effective monitoring and all the residents are asked to remain in home quarantine. The lockdown and social distancing measures are imposed without breach, and those found violating are sent to the government's quarantine facilities away from the hotspot. Residents with COVID-19 symptoms are asked to report to the health authorities, which does contact tracing and rigorous testing. Suspects who test positive and have comorbidity are quickly moved to special hospitals.
A Delhi government hospital was shut down on Wednesday after a doctor tested positive for coronavirus. The Delhi State Cancer Institute's OPD offices and labs have been shut and are being sanitized, NDTV reported. Those who came in contact with the doctor are also being quarantined. Reports said that the doctor may have contracted COVID-19 from relatives who had returned from UK. Uttar Pradesh reported its first coronavirus-related death on Wednesday after test reports of a 25-year-old man who died 2 days ago came positive. Officials said that the victim was suffering from kidney and liver ailments and was admitted at Gorakhpur's BRD hospital. 2 lab technicians who had taken the samples have now been put under quarantine.
Senior Congress leader Kapil Sibal on Wednesday took a dig at the government, saying that there were 2 Indias, with one at home doing yoga, watching Ramayana and playing Antakshari, and the other trying to reach home and fighting for survival. A large number of migrants have been leaving their workplaces and walking down to their native places, hundreds of kilometers away due to the lockdown. Sibal's attack was in reference to Prime Minister Modi sharing a video of a yoga asan, Information and Broadcasting Minister Prakash Javadekar announcing the rerun of Ramayana and Mahabharata recently on DD, and Union Minister Smriti Irani playing Twitter Antakshari during the Janata curfew.
Another 864 people died in Spain over the past 24 hours, its highest daily death toll from coronavirus, as infections jumped to over 1.2 lakh from 94,417. This is the 5th day in a row that Spain has officially recorded more than 800 deaths. The country has the 2nd deadliest outbreak in the world after Italy, and as of Wednesday, it has become the 3rd country to report more than 100,000 confirmed cases.